I think that there are definitely positions that's what they're looking for. Automatically, without a graduate level degree, your resume will not even get through the door.
Welcome to the Business of Healthcare, a twice-monthly podcast from the Center for Healthcare Leadership and Management. The center is based at the Naveen Jindal School of Management at the University of Texas at Dallas. The show, like the center, brings together business leaders and other forward thinkers to discuss how best to meet the challenges of a rapidly changing, increasingly complex healthcare industry. I'm your host, Dr. Britt Berrett. I'm joined today by Meagan McDonald, who is pursuing a degree in healthcare management at the Jindal School of Management. I will admit she's one of my favorite students. She took the Intro to Healthcare Management class and was a superstar, and comes from a non-traditional educational background. Meagan, great to have you with us. Welcome.
Thank you. Thanks.
So healthcare management, why the interest? What drew you to the field?
Well, I actually was plucked out of managing a Starbucks from a doctor to manage her family practice clinic.
Wow. Out of nowhere, and began your pursuit of a professional degree in healthcare management. Well, I take that back. You were actually working and decided to come back to school. Is that right? Correct.
So I managed the clinic for about 7 years. And at that point, I realized that there was no further I was going to be able to go without a degree.
That's an interesting insight. Many people ask us, do I need higher education in healthcare management? And the answer is emphatically, absolutely. You can get an entry-level job, and many people do, but if you don't have a degree, it's hard to get promoted. Was that your experience as well?
Yes, there was many jobs I was precluded from because not having a bachelor's.
So why UTD, other than we're awesome, but why UTD?
Well, because I'm a non-traditional student, I have a family, and this is where my home is, and so it was close to home and convenient, really.
Good. Tell us about what you know about UT. Or before joining the campus, what was the background noise about the place?
Well, I think a lot of the noise was based around the more STEM programs, and then I knew that there was a business school, which was exciting. I just didn't know about the healthcare management degree. Yeah,
it's new. We began in 2015 and have developed an incredible program with some significant academic researchers, and for me, just as important, practitioners in the field who practice what they preach and can share that with you. Now, you've had a couple of classes so far in healthcare management. What have you taken so far?
I've taken Intro to Healthcare. I've been fast-tracking into the master's program, so I've done a couple of the master's level, graduate level classes.
It's Fast Track. Okay, so that's a program here at UTD.
Yes.
And tell us a little bit about what Fast Track means.
So Fast Track, there's a GPA requirement and having to be a senior, but once you're past that GPA and a senior by credit hours, you can take classes that are duly accredited to both your undergraduate and your graduate degree.
Okay, so how quickly can you get a master's degree in an undergraduate?
So you can do in a total of 5.
5 years?
Yeah.
Wow. Do you have to take the GMAT or any of those entries?
No entry.
Nice.
Yeah.
Nice.
Straight into the program.
Great. So if you qualify academically, you enter the program within 5 years, you have your undergraduate and master's degree. Why do you think a graduate degree is so important, Meagan? What's the deal?
I think that there are definitely positions that's what they're looking for. Automatically, without a graduate level degree, your resume will not even get through the door.
Yeah, that's been my experience as well. Healthcare is interesting. We have a lot of very well-educated and trained individuals in the clinical space, physicians, nurses, pharmacists, and the expectation is that there's a higher level of preparation for individuals that would be participating in that side, the business side of the healthcare delivery. So, yeah, graduate degree is mandatory.
Yeah, essential.
Okay, so let's ask this. What have you enjoyed most about the program?
I think what I've enjoyed most about the program is getting to hear from the professors that are working within the industry and getting insight into the healthcare industry here in DFW, but overall just what a working professional looks like with that education level.
We got some of the finest healthcare systems in the world here in the DFW, but there's a lot more than just that. Ambulatory, post-acute, meaning long-term care, senior care, assisted living, biotech, those kind of things. Where are you going to pursue? What's your passion?
Yeah, that's a tough question.
Yeah.
I mean, I think that traditionally going into a hospital system as a non-traditional student might be a little more difficult for me, but I think that there's a lot out there. I think something obviously in operations, marketing might be something else that I'm possibly going to pursue.
I can see that for you. Have you had in class? I think communication is one of your fortes, and being able to articulate a message about a healthcare delivery system or a product or a process, or that I think is there's a real demand and need. Sometimes our clinical folk can talk clinical, but they can't talk business, and they recognize that, so they reach out to men and women like you and I to help lead that effort. I've heard it stated that for every clinical person, there are 17 people behind the scenes. Now, that's true. You look at a physician's office, you have one doctor, but you have a whole slew of other people. Tell us a little bit about the healthcare field and why it's so attractive to you. What draws you to the delivery of care?
I think that number one, it's a field that's not going to ever go away. There's always going to be jobs available on the business side of healthcare because we're always going to need healthcare. Mm-hmm. It's also very dynamic right now, and that's really exciting to see all the change and be able to be a part of that and maybe influence some of that change.
That's a good point. One of the things that drew me to the industry, in addition to all those, was it's purpose-driven. It's meaningful. It's, I think it'd be hard for me to get up every morning and get too excited about something that there's not a cause behind it. Do you feel the same?
Absolutely. So managing a clinic and getting to know patients and really, families and what's their dog's name and all that, just having that, knowing that I'm impacting people on a daily basis is very important to me.
It's not a cubicle kind of environment. It's and you're not a cubicle kind of person.
I am not.
And we're finding that time and time again. Well, healthcare right now, spending is crested over $3 trillion. It's actually moving faster to $4 trillion, 20% of the gross domestic product. But you're right, it is in a state of flux. So if you were going to kind of look to the future and you're in that space of getting your educational degree, having a family and having responsibilities, where do you think the growth areas will be in healthcare? What's your take on that? Where do you think the jobs will be into the future?
So I think that senior care, 65 and older, that growing or the exploding baby boomer population is really where the growth that we're going to see in services for them and what they're going to need as they age. Yeah,
that's a good point. We're seeing a lot of effort to address their demands, right? And mobile devices. How about technologies that?
Absolutely. There's, every day, and we are the number one leader that America is in healthcare technology, so it's always going to be a growing industry here.
Yeah, that's fueling a lot of our expense. One area that I find fascinating is the question of bioethics. Because with that new technology and the graying of America, we've got some real important ethical questions that we need to ask. And I think we need very strong and capable leaders in key positions to be able to respond to those issues. That's excellent. Let's talk to those in our audience that are thinking about a degree in healthcare management. What would you tell them? What advice would you give them? What thoughts would you share if they're pondering the idea of coming back to school or shifting their degree from some other area into the business of healthcare?
I would say that it's there's a very large field. I think basically all of the schools that encompass the Jindal School of Management, every single one of those could be also encompassed in a healthcare management degree. Like I said, there's marketing, there's IT. I think that whatever your passion is that you can find that as a job, as a pursuit in healthcare.
Yeah, that's been frustrating. I'll talk with some students. They'll go, well, just tell me what to do. Just tell me, you got to do X, Y, and Z. Honestly, I think that's why a lot of students go into pre-med. They're not quite sure, but they think, okay, I'll be a doctor. They'll get into their undergraduate first year, second year, and it's just not right for them. But they realize that there are lanes and guardrails that they have to follow. Within healthcare management, you get to consider what you like. And I think that's part of the exploration of college, which is a good thing. The Jindal School of Management provides all sorts of lectures, panels, opportunities to learn. We've got students that are getting into healthcare law, healthcare architecture. If you think about it, building a hospital, We have students in building biotechnical firms using IT platforms. I had a student come into me, and I probably shouldn't share this on this podcast, but he came up with a cool idea for patients that are discharged from the hospital and giving them iPads so they can interface with their care providers, their pharmacists, schedule appointments, access YouTube videos. You know, you're post-op on a hip replacement, you want to know what physical therapy you should get and how you should do the different treatments. I just thought that was a cool idea. Unfortunately, healthcare has not engaged in that, so I think we're right on the precipice of some real significant change. Your thoughts along those lines of the integration?
Yeah, I think one of the positions that I've held was helping with a patient-centered medical home and talking about aftercare and follow-up with these patients, and having access to technology is huge in that not only just communication between doctor and patient, but also with education, like you said, of these, videos on how to use, a device or something like that. There's tons of opportunity.
Right.
This episode is brought to you by the Center for Healthcare Leadership and Management, the definitive resource for healthcare management education in North Texas. The center is based in the Naveen Jindal School of Management at the University of Texas at Dallas. It plays a unique role in training the next generation of healthcare leaders to meet local, regional, and national demands. The Jindal School uses its strengths in accounting, administration, finance, marketing, and information systems to educate highly qualified personnel for healthcare administration and executive leadership positions. The center is home to 7 healthcare leadership and management programs, including undergraduate and graduate programs, as well as executive programs for physicians and working professionals. For more information, visit us online at jindal.utdallas.edu/healthcare.
Social media is also taking a new look at how we access information and access caregivers. I'm a big Yelper. I don't know if you knew that, but
nope,
when my wife and I have been married 31 years, and my big claim to fame is when I take her out to dinner, I ask her what kind she likes, and then I go on Yelp, and I become a hero because I pick a restaurant that's a Yelp. And but I don't think you can do that with doctors right now at least. Or there's small. We've had a couple of guests on our program that talk about that. But there will come a day when social media will rule the day, and if you need a physician, you'll get right on social media. You'll learn all about he or she and access them. Schedule yourself via the phone, pay it via the Apple Pay or whatever. And then also follow up treatments, schedule and order equipment or pharmaceuticals.
Yeah.
With fast
there's
approaching.
There's some platforms out there that are already doing some of that, I believe. I just, it's everything is new and up and coming. So it's amazing what we can do and what the possibilities are. Absolutely.
And that's the nice thing about, when we talk about UTD, it's got a great reputation for really strong analytic capability and a very serious student body. It's not a party school. Right.
I would 100% agree with that. It's one of the things that really attracted me when I started taking classes here is how serious the students were.
Yeah.
And as a non-traditional student, that was impressive to me. Yeah, the younger students are even, serious.
Impressive, yeah. I was the homecoming grand marshal 2 years ago. So I found that very, very impressive. But it's fun, but it's a very serious student body. So you're associating with men and women who really care about their education. And this is not a party. It's a professional pursuit, and you meet great men and women who share your same desires and efforts. So non-traditional really do extremely well here. Well, let's walk through just for a moment the undergraduate program. Within the undergraduate program, there are 5 mandatory classes. You took my Intro to Healthcare Management, which talks about what Medicare and Medicaid is. It's actually, I think, a class that anyone would really enjoy because we talked about Obamacare. We dissected the Affordable Health Care Act, really effective. Healthcare accounting is the second class. Very important to understand the economics and the profit and loss and how those numbers are different than some other industries. We have healthcare economics, which is the third class. It's Econ 3330. That takes a macro view of healthcare spending. We have the fourth class, which is healthcare IT and integration, which is fascinating. We talk about big data and we talk about looking at numbers. Well, apply that kind of discipline to the healthcare delivery system. You get some real opportunities for improving quality, reducing costs, and improving accessibility. The fifth required class is healthcare regulatory, and we have an excellent faculty with all of the classes, but we have a faculty member who just fills the house, and every week they talk about a new regulatory dynamic, whether that's the FDA or the Joint Commission or Medicare, Medicaid. So that's the undergraduate. The graduate is interesting. So we have those that want to fast track into which you're pursuing. You'll be taking or have taken a couple of graduate level classes. Tell us a little bit about that.
So I've already been able to take the American Healthcare System, which is the intro at the graduate level, which was an excellent overview class, and just added upon your class, the Intro to Healthcare class, at the graduate level and expanded that information. I've also taken the healthcare law at the graduate level, and I'm right now enrolled in the healthcare econ at the graduate level.
I teach a graduate class, hospital operations, which is really fun. There are 30 students in that class, and every week we tour a different hospital. But it's more than that top of the waves tour. We go down deep. I remember at UT Southwestern, in their new facility, we went down to their distribution area and how they distribute tens of millions of dollars worth of supplies throughout that millions of square feet of office and hospital space. And so every week it's a really in-depth look at that. So graduate level classes really, I think, are exemplary.
Yes.
So now, when do you think you're going to graduate?
My plan is to graduate in December with my undergraduate, and then the following year, December, graduate with my master's in healthcare leadership.
Fantastic. Congratulations to you. Interestingly enough, we have in the executive education program a graduate, a master's of healthcare science and leadership for physicians. So about 20 years ago, Dr. McCracken came to Dallas and said, our physicians are exemplary, but they don't have a business background. So he began a master's degree with the possibility for an MS MBA program. It's got a 2-year waiting list. And this group of physicians work in cohort models, meaning a group of maybe 30 or 40 docs gathered together. And they meet every 6 weeks for a Friday, Saturday. I think it's a Saturday, Sunday, Monday, Tuesday. There was one just this weekend, which was on dealing in complex organizations and how to introduce strategy and strategic planning. It was a fascinating class, but the students were at tables. We saw that as so successful, we decided that we would reach out through executive ed and provide a graduate program, Master's in Science and Healthcare Leadership and Management, for working professionals. So we also have a program that once a month, students meet all day Friday, all day Saturday in cohort models. And they navigate through about 2 years of education and come out with a graduate degree. So you'll be able to blaze through because I think you have time in a traditional model. But for those working executives that need that graduate degree to be promoted, that has been a phenomenal success, and the enrollment is probably growing. We're working in cohorts, groups of no more than 40, 45 students. So you have a small group of executives within the area that can work together. When you finish your degree in healthcare management and leadership, talk to us a little bit about how you're going to give back to UTD. Talk to us a little bit about the relationship that UTD has with you, both on a personal and a professional level. What have you heard and what do you anticipate?
I think that as a graduate of UTD, and being an ambassador for the programs here will be the number one way that I can give back to UTD, telling people about what's available, what the opportunities are here at the school, because I think it's invaluable for people to continue to learn throughout their career.
Yeah, inspire them. Good.
Absolutely. I think also the opportunities that will be set before me because of having UTD on my resume, having that degree, are going to be innumerable. I think that the reputation within the community here in DFW is so sound that it's going to open up a lot of opportunities that otherwise I wouldn't have after attending this school. And finally, I think that probably maybe the opportunity to be a guest speaker to come back and talk to students about what it's done for me in my career and where I've been able, my trajectory because of the education I've had here.
And that truly has been one of the benefits of UTD and our location in the DFW. We have panels, guest speakers, site visits. We traveled 2 locations. That's been a real blessing for the community and for the faculty and the students. So, yes, I'm going to be inviting you back to give a guest lecture that there's life after college and that non-traditional students can be very successful, such as you are and will be into the future. And also a commitment to our profession. We have a commitment that healthcare leadership requires tremendous skill and capability and training and preparation. And I think that's what the Center for Healthcare Leadership and Management does. It prepares the next generation of leaders. Well, I'm delighted to have Meagan McDonald with us today. She's a shining star and looking forward to tremendous success into the future. If you have any questions about the Center for Healthcare Leadership and Management here at the Jindal School of Management at the University of Texas at Dallas, please give us a call. We can be reached via the web at jindal.utdallas.edu or shoot us an email at healthcarebizpodcast@utdallas.edu. That's healthcarebiz, spelled B-I-Z, podcast at utdallas.edu. This is Dr. Britt Berrett, Director for the Center of Healthcare Leadership and Management, and we are in the business of healthcare. Thanks for listening to the Business of Healthcare podcast. Join us online at businessofhealthcarepodcast.com to find episode notes, links, and more. Be sure to subscribe to the Business of Healthcare podcast on Apple Podcasts or your favorite podcasting app. To learn more about the Center for Healthcare Leadership and Management, go to jindal.utdallas.edu and then search under the Centers and Institute tab on the navigation menu. Also, we want to hear from you. If you'd like to provide feedback, make suggestions for future guests or show topics, or just want to get in touch with us, well, send us an email at healthcarebizpodcast@utdallas.edu. Biz is spelled B-I-Z, and let us know how we're doing. I'm Dr. Britt Berrett, the Director of the Center for Healthcare Leadership and Management, and we are in the business of healthcare.